Doctors don't die like the rest of us. Have you ever thought about why you don't know doctors who've gone to nursing homes? Wise people in any profession at any age have good reason to think about the end of life, how it might look, either because they're planning for retirement and the advisors push for a long-term care policy, or maybe because they've seen a loved one suffer the loss and indignities of moving into a nursing home. You've seen it yourself, bedridden or confined to a wheelchair, disheveled, wearing a confused look and a diaper, never to return to the life she loved. My name is Rita Silin. I have worked as a nurse anesthetist for 4 decades. I've practiced in the Deep South, on the East Coast, in the Midwest, and finally in the Pacific Northwest. I have never spoken to anyone who thinks living in a nursing home sounds good. Truthfully, most say they would rather die first. Sadly, only a very few understand that they have control, the control to decide what measures are taken to sustain them as they age and become unable to think clearly and participate in decisions for themselves. In this country, we have the constitutional right to refuse medical care. If we are sane when we write the directives, our wishes must be honored. But you have to write them. Consider comedian Joan Rivers, former First Lady Barbara Bush, and most recently, Senator John McCain, all of whom who did just that. I can help you speak for yourself when you no longer have your voice, making your power of attorney your mouthpiece, not your decision maker. Now, how do I do that? I helped my mother when at age 88, she cried to me to never let her live the way her own sister was living in a nursing home. We sat together, each wrote 1 page in our own handwriting, specific instructions, clear declarations of what we would not give consent for, refusing to consent to measures that were intended to keep us alive long after our lives as we knew them were over. Is your advance directive strong and clear enough to protect you? Will your power of attorney speak your mind or cave to the heavy burden of guilt when choosing between letting you go or consenting to measures that sustain your life, disabled and dependent? What's more, do you have children, siblings, a spouse? Please believe me when I tell you what I have seen often. At the deathbed of a loved one, people are scared, sad, and confused, and they often disagree, sometimes loudly. The responsible physician and the hospital, they want clarity. In the absence of clarity, accepted medical protocols, steps to maintain and support life will be used, abandoning that patient's wishes in order to avoid liability and lawsuit at any cost. And who can blame them? Perhaps it isn't at the deathbed. Perhaps you develop dementia or Alzheimer's. If you're unable to speak or think clearly, you will no longer be allowed legally to control your own destiny, consenting to or refusing measures that sustain your life after the life you lived and loved is over. Accepted medical protocols that sustain life functions are used every day in our country in nursing homes where many live for years, bedridden, wheelchair-bound, in diapers, confused, dependent, disabled. Handwriting what we do not want is a powerful tool to avoid languishing in humiliating and disrespectful scenarios. It is also a sound investment. My mother, my hero, wrote her own handwritten living will in 2013, refusing the medications and the interventions that are designed to sustain life indefinitely. She had a serious fall 5 years later and died exactly as she had hoped, warm, dry, pain-free, anxiety-free, with me at her side. 7 days later, not 7 months, not 7 years in a nursing home. Her handwritten, simple directions told all who cared for her exactly what she did not want. She gave them clarity, no confusion, no argument. So how do you do this? how do you write this handwritten living will? Well, I want to help, and my contact information will follow so that you may reach me personally, and I hope you will. But let me walk you through a little bit so you can take charge on your own and be your own hero. First, by accepting that we will all arrive there, the end of life. None of us will get out of this alive. Death is not a failure, and Mother Nature is a gentle physician. I have chosen her as mine once I'm clearly unable to live the life I have loved, independent, making choices for myself, and having fun. It's not complicated. Let's start. Decide under which conditions you want this document to speak for you. For me personally, when I am no longer able to give legal consent from my own mouth due to debilitating stroke, advanced tumor, severe trauma, progressive illness like Alzheimer's, or the frailty of advanced age, and there is no scientific data to support that I would ever recover to live the life I love, for me, living at home on my own, then I refuse the following life-sustaining measures. Number 1, antibiotics, none, not for pneumonia, not for urinary tract infection. Number 2, blood thinners, not aspirin, not Plavix, not Coumadin, any drug meant to thin the blood. Blood pressure medication, specifically no beta blockers. Interventions, no feeding tubes, temporary or permanent, no force feeds, and no IV hydration. If following these specifics means that I must be moved to hospice, I give permission for hospice. I welcome treatment for pain and for anxiety. I give permission for both. Okay, now think, what child or sibling or spouse will be able to argue your own intentions if you actually wrote these specifics in your own handwriting? So, now you've written your own handwritten living will. Now what? Sign it in front of a witness who signs it too. If your state demands a notary public for your advance directive, do it for your handwritten living will. Follow your state's expectation. I am not a lawyer, so ask yours how to assure that your handwritten living will be honored. Then, make 3 copies and give it to people you trust. The sad truth is that your lawyer and your primary care doctor will not come to your deathbed. Give these copies to people who will be there and who will speak for you when you have no voice. Everyone needs one of these. This is your state's boilerplate copy of an advance directive. I hope you have one, and I hope you filled it out and have filed it in a safe place. But more importantly, I hope you have this. 1-page, handwritten living will attached with a staple to your advance directive. This is the statement that details what I refuse when I will never return to the life that I know to be my normal life. And so, I defined my normal life. And in writing yours, you can too.